Let me ask you, sir, the president is saying, Republicans are saying that this is going to give states more flexibility in the way that they are reapportioning the Medicaid funds. Let me ask you about that. And also, will this have a greater impact, the president's proposal, here in Minnesota, because we are one of those states that was mentioned in the package that did expand Medicaid under Obamacare?
Yes, exactly. I mean, I went to a hospital in Perham, Minnesota, outstate. We had a provider there start to cry because her mother gets home health care through Medicaid. That will be cut. She won't know what her mom will be able to do. This will give states flexibility, sure. It'll give them the flexibility to drop the protections for people with pre-existing conditions. Those people will be dropped from those protections. That's one of the major fundamentals of what we did with the Affordable Care Act, so that people with pre-existing conditions can't pay so much more and basically be priced out of insurance.
Well, let's talk about prices, because one of the problems here in Minnesota, as you know, is that there was a segment, and is still a segment, mostly self-employed people, farmers, people in rural areas, who end up paying exorbitant premiums. And is this going to be a fix for that? And if not, what is the fix for that? Because that's a problem right now.
For example, for people 50 and older, their rates will spike. That's also what the Congressional Budget Office said, that the cost of premiums will go up, and of co-pays will go up under this. What we need to do is address what isn't working in the Affordable Care Act, and one of those is the exchanges. And what we need to do is create some kind of public option so people can choose between insurers. And what we don't need to do is undermine the insurance companies by putting in uncertainty, which is exactly what the president has been doing, and the House has been doing, and everyone has been doing, so that insurance companies withdraw from the market. We're doing the exact wrong thing. We should also address the price of pharmaceutical drugs. I have a comprehensive bill to do that. We need to, those have spiked in the last 3 years, and we need to address that.